Hello, I'm so glad to be with you again. We're excited about the efforts and the devotion that you have shown in establishing the first annual Congress of Lifestyle Medicine sponsored by the Mexican Society for Lifestyle Medicine. We're beginning to understand that today's chronic diseases like heart disease and diabetes, obesity and hypertension cannot be cured with pills and procedures. It's estimated that close to 80% of Mexico's causes of death relate to these chronic diseases. They're also called non-communicable diseases to set them apart from the infectious diseases. You see, when it comes to these non-communicable diseases, to these chronic diseases, as the name suggests, they're chronic. They do not end. They're not curable. The best that technological medicine can offer is to palliate and alleviate the obvious symptoms of these modern killer diseases. Let's take coronary heart disease. You have medications, you have procedures, you have bypasses, you have stents, and yet the disease continues. The coronary arteries continue to narrow and harden. Anginal pain returns. Another heart attack follows. And in the end, you're going to die with heart disease because medicine has no cure for the underlying disease process of atherosclerosis. Or take type 2 diabetes. Your blood sugars are high, your physician prescribes metformin, and after a while, the dose is being increased. Sometimes later, other diabetic medications are added. And in the end, you're on insulin injections. And once again, in due time, the insulin doses must be increased to maintain your blood sugar levels. At the same time, your weight is going up because almost all of these diabetic medications increase your appetite, and with an increased appetite, your excess weight increases too, which only then worsens your diabetic conditions. It's obvious. Technological medicine tries its best, but it has not found a cure for common chronic diseases. And yet, a cure is available. And so you may ask the question, well, how and where? You do it with an enlightened lifestyle. And you do it with intelligent self-care. By making better lifestyle choices, you give your body a chance to activate its self-healing processes. This involves a consistent exercise program, sufficient hours of sleep, and are you ready for this? It involves a simple, more traditional diet of foods as grown. So let me introduce you to forks and knife, instruments of hope, health, and healing. But let us review my previous presentation, Fork and Knife, Weapons of Mass Destruction, where we looked at the role of diet in the cause and etiology of these chronic diseases. We begin with recognizing that chronic diseases have not always been with us. We looked at heart disease in the United States in 1920. Heart disease then was so rare that one may find one heart attack a year in an average town. That's it. One a year. Today, we are talking about 3,000 heart attacks a day. And cardiovascular disease is the #1 cause of death in our society. We also looked at the change in the size of the American chairs. Starting in 1900, over the next 70 years, the average chair did not change very much. It just went from 43 to 45 centimeters. But look at the change since then. Now it's 61 centimeters. You see, beginning in the 1980s, America emerged larger than ever, so that today 74% of the adult population is either overweight or obese. And with being obese, we must worry about diabetes, which has been doubling every 10 years. And we must also worry about high blood pressure, about heart disease, arthritis, asthma, sleep apnea, and various adult cancers. They're all promoted and fueled by excessive weight. And then we looked at the incidence rates of breast cancer. Breast cancer rates dramatically increased beginning in the 1960s to what they are today. And the question is, with all the advances in medical technology, Why do we have such an increase in most of these chronic diseases? Could this increase be related to our change in diet? Do you recall this chart? Whenever you have an increase in a society's income, the foods begin to change. We shift from foods as grown to industrialized food products. From potatoes to potato chips, from corn to corn chips, from beans to burgers, from water to soft drinks. We now refine the foods. We strip them of their nutrients and we pack them with salt, sugar, and fat and too many calories. And the result? Our taste buds begin to change, as do our waistlines and our weight. And with these dietary changes, we see the emergence of a typical Western diet. The right-hand column, take a look at it. It consists now mostly of fats and oils and sugar, of white flour starches, and of excessive protein, mostly coming from animal sources. So to unpack this, we talked about two major dietary shifts. The first shift took us from whole foods to industrialized products, from slow foods to fast foods, from eating at home to eating out. And in the process, we increased dramatically the number of empty calories to the extent that today 44% of the calories eaten in America come from empty calories. These are calories rich in taste but poor in nutrition. And then we looked at the second dietary shift, a big increase in the consumption of meat. We went from 56 to 91 kilograms per person per year. And here you see the outcome. Here you see the composition of the American diet that everybody wants and is clamoring for. Look at this. 55% of the calories come from refined, processed, engineered foods. Another 31% comes from dairy and animal foods. And only 14% of the calories that we eat, only 14% in America, come from fruits, vegetables, whole grains, legumes like beans and lentils, and some nuts. These are the very foods that come out of the hand of a master designer. These are the foods that come to us in nature. These are foods as grown, but they only represent now 14% of our calories we consume today. No wonder that Dr. Walter Willett from Harvard University asserts, epidemiologists have long known that the major determinants of our killer diseases are dietary and lifestyle factors. Well, we talked about the heart. We talked about the coronary arteries sitting on top of the heart muscle. We looked at coronary arteries in cross-section and how they gradually over time fill up with atherosclerotic plaques consisting of fats, cholesterol, calcium, and a lot of dead cells, causing a progressive narrowing and hardening of the arteries, reducing optimal blood flow to the target organs. This underlying disease process often has no symptoms. It's asymptomatic. You see, the first sign of heart disease for 40% of the people is sudden death. Furthermore, this pathological process is not only affecting the coronary arteries to the heart, but all the major arteries from the top of the head all the way down to the feet. These are many diseases in many different locations with many different names, treated by many different medical specialists, but there's only one underlying pathology, and that is atherosclerosis, the narrowing and hardening of the arteries. This disease process then expresses itself in the coronary arteries as myocardial infarction or angina pectoris, in the arteries of the brain as a stroke, senility, memory loss, hearing loss, visual loss, and in the kidney arteries as hypertension. This disease process expresses itself also prominently in the penile arteries as erectile dysfunction and impotence, and often becomes the canary in the coal mine, an early sign that atherosclerosis is taking over the body. We then ask the question, what are the antecedents for these diseases? What are the predictors? What drives this disease called atherosclerosis and its inflammatory aspects? And we began to look at risk factors. We looked at the risk arch. And we said the higher these risk factors appear on the arch, the more powerful they are in driving this disease. Well, take a look at the 3 most powerful contributors to this disease process. The number 1, cholesterol. Number 2, high blood pressure. Number 3, smoking. And then you see diabetes, obesity, and triglycerides on the left side, and inactivity, stress, and perhaps genetics on the other side. Now, Dr. William Corner was a pioneer in atherogenesis in animals. He told his medical residents, if you want to produce atherosclerosis and a heart attack in monkeys, all you have to do is feed them a lot of cholesterol and saturated fat. And then we looked at the Harvard studies that suggested that 70% of stroke is preventable, 71% of cancer, 82% of heart disease, 91% of type 2 diabetes, all totally preventable if we could make some dietary changes. You see, experts have estimated that some 80% of chronic disease in America, and probably also in Mexico, could be prevented by making significant changes in diet and exercise. So let me close my review with a powerful statement from Dr. Dennis Burkitt. He was a medical giant who not only promoted the concept of dietary fiber, but he also found the answer to a special cancer in African children that now carries his name, the Burkitt lymphoma. When he was honored in front of some 600 physicians upon receiving the equivalent of the American Nobel Prize in Philadelphia in 1992, they heard him say, the greatest medical discovery in the last 20 years, from 1970 to 1990, was the understanding that our modern killer diseases are largely lifestyle related, and therefore these chronic diseases must be preventable and potentially reversible. So, reversing chronic diseases. Yeah, this brings me to my topic today, fork and knife, instruments of hope, health, and healing. It was in 2004 when President Clinton, at the age of 59, underwent quadruple coronary bypass surgery for relief of his chest pain. And then 6 years later, in 2010, with recurring chest pain, he underwent a double stenting to keep the restenosing arteries open. Well, let's take a look.
I was lucky I didn't die of a heart attack.
Former President Clinton, like too many people, was busy. And for years he ignored warning signs from his heart. But in 2004, during an exhausting book tour, there was something different.
I had a real tightness in my chest when I was getting off the airplane, and it was the only time I'd had it unrelated to exercise.
We're here outside New York Presbyterian Hospital. In just a couple of hours, President Bill Clinton, former president, is scheduled to undergo surgery.
So I immediately went down to our local hospital, and they did a test. They said, you got real problems. They hustled me down to Columbia Presbyterian, and they confirmed the determination that I had serious blockage and needed the surgeries.
The doctors immediately knew options were limited. The 58-year-old Clinton needed to have his chest opened, his heart stopped, and surgery performed.
There's no medical treatment for reversing the obstructions that have already formed in his blood vessels.
I got Hillary and Chelsea there, and all I remember is it was happening fast, and everybody who cared about me was scared, and I felt rather serene. I thought, gosh, we dodged a bullet. I didn't have a heart attack.
On Labor Day in 2004, Mr. Clinton had 4 blood vessels bypassed.
Starting this morning around 8 o'clock, he had a relatively routine quadruple bypass operation. We left the operating room around noon, and he is recovering normally at this point. So I think right now everything looks straightforward.
Another life saved, right? Really? Was his heart disease really cured? Well, Clinton was known as a lover of fast foods. When he was readmitted 6 years later for recurring chest pain and scheduled for a double stenting, his cardiologist wanted to protect his reputation and released this statement. He said, "His recurring chest pain is not the result of his lifestyle or his diet. No, 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 no. What we have to remember is that heart disease is a chronic condition. We don't have a cure for this condition, but we have excellent treatments." Yeah, let's unpack those excellent treatments. You know, medical technology provides indeed many successful outcomes for acute and episodic diseases that come and go. We are unexcelled in diagnostics and in emergency care. And for chronic diseases, we have many, many treatments, but cures for our most common killer diseases are rare and very elusive. Take bypass surgery, for instance. We do 400,000 bypass surgeries this year. The average cost is 3 million Mexican pesos per surgery. And yet, when you look at the bottom of this next slide, you see that within 12 to 18 months, some 40% of these grafted vessels are no longer functioning. That's a graft failure of 38 to 46%. You see, these grafted vessels, as well as the native arteries, are not protected from renewed atherosclerotic plaque buildup unless the patients receive an intensive instruction. You are lucky. You have been given a second chance. Take advantage of it. If you really want to keep these grafted vessels open and prevent the other coronary arteries from clogging up, then you must stop smoking. You must get into an exercise program, and you must follow a diet where you must limit your cholesterol and your fats. You must follow a whole food, plant-based diet. That's instruction that people have to get and receive after a bypass, after a stent, after a heart attack. But it doesn't happen. We know that the best and most even-handed estimates are that only about 10% of heart attack patients have their life extended after bypass surgery. To take care of heart disease, we also have angioplasty and stents. Take a look. Every year in America, we perform more than 1 million of these stents with an average cost of some 700,000 Mexican pesos. Do they last? Somebody said somewhat disrespectfully, well, stents are like Pringles. They're like potato chips. You never just take one. There are many heart patients who consecutively have had up to a dozen of these stents. After the double stenting, the chief of cardiology commented on Clinton's case and said, essentially, a stent is just a tune-up. We see people like this who come to us every 4 to 5 years. Yeah, that's very optimistic actually, because most of the data actually suggests that they don't last that long. As a matter of fact, they may only last that long if patients make the needed lifestyle changes under the direction of a leading physician or dietitian. Now, what about statin drugs? These cholesterol-lowering drugs are the most profitable drugs in the history of medicine, with revenues of over 20 trillion Mexican pesos last year alone. Now, regarding their efficacy, let me share with you some of the statistics. When these statin drugs are used for secondary prevention purposes, to reduce cholesterol after heart attack, they can actually reduce the all-cause mortality by 10 to 20%, and that's good. On the other hand, most of these statin drugs are not prescribed for secondary prevention, they're prescribed for primary prevention. If they are prescribed to high-risk people in hopes of preventing that first heart attack, then we talk about primary prevention, and then the benefit, if any, is very, very small. As a matter of fact, a major meta-analysis of 11 randomized controlled trials with over 65,000 participants showed that the statin drugs indeed dropped the LDL cholesterol by some 40 points from 139 to 98. And you say, well, that's great. If cholesterol is really that important, obviously these drugs serve their purpose. Well, but then comes the second line. Take a look. But no evidence was found for any benefits of statin use on all-cause mortality. The statin drugs lowered the cholesterol numbers, but they did not benefit the heart or affect the longevity of a person in this high-risk primary prevention setting, where they followed these patients for 4 years. Here's an editorial in the Journal of the American Medical Association by Dr. Rita Redberg. She wrote, "We have underestimated the risk of statin drugs, approaching 20% of patients at risk for muscle aches and pains and at risk for developing diabetes and memory loss." She continued, "If we gave 100 men who never had a heart attack before these statin drugs for 5 years, we might expect to prevent how many? How many does she say? 1 to 2 heart attacks. Imagine you take 100 men at risk for a heart attack and you give them these statin drugs to lower their cholesterol by 30 to 40 points. You give them these drugs for 5 years at a cost of 10 million Mexican pesos, and the clinical outcome? You might be able to prevent 1 or at best 2 heart attacks in these 100 men in 5 years. And then the editor asked the rhetorical question, well, what's the answer then? And she answered, a healthy lifestyle, a simple diet, and daily exercise. Now, what about medications used for lowering blood sugar or high blood pressure? Well, again, these medications don't cure. At best, they control. And there are always side effects, and sometimes serious side effects like death. Here's the ACCORD study dealing with diabetics. There, researchers provided maximum medication doses to evaluate the effect of changing the disease progression and the complications of diabetes. If we give them maximum dose, maybe we can create more benefits. The study, however, had to be prematurely stopped because of excessive deaths from heart disease. And we have similar results in evaluating some of the high blood pressure medications. While these drugs were found to be helpful in preventing and delaying a stroke, they had no effect in preventing a heart attack or heart disease event. And there are always complications and side effects that can occur, such as impotence and decreased libido with these antihypertensive drugs. Here you see a patient and he reports, well, the doctor told me I would probably be taking blood pressure pills for the rest of my life. Well, sure. And probably not just 1 drug, but 2 drugs and 3 drugs and 4 drugs, different blood pressure medications. In addition, you will have to take several drugs to combat and counteract the side effects of the blood pressure medications. So when it comes to chronic diseases, the idea that for every ill there's a pill, that's only the dream of the pharmaceutical industry. It's not reality. Well, it may work for pneumonia or some other infectious disease, where some antibiotics can knock out the pathogen, the germ, in 10 days. But dealing with chronic diseases is totally different, because chronic diseases are not so much related to some pathogen or to some germ. Instead, they're related to our lifestyle habits, and especially to our diet. Here you see an article in the prestigious New England Journal of Medicine. The authors here write, cultural expectations of immediate, simplistic solutions have been bolstered by consumerism and advertisements and fully exploited to generate demand for therapies that are, often probably marginally indicated and potentially unsafe. Have we possibly oversold the idea that for every ill there's a pill? Take a look. This data shows that prescription drugs now are the number 3 cause of death in America, responsible for 11% of all American deaths, right after the death from cardiovascular disease and cancer. These are prescription drugs, legal drugs. Now, either the drugs were not taken properly, or the complications with other medications were not anticipated, or they were not just properly prescribed. Now, look at this picture. What do you see there? Well, You see people on the ground in green uniforms, and they all have mops in their hands. And there's water on the floor, and they're frantically trying to mop up that water. They're very devoted to their art. They're even passing out color-coded umbrellas to patients to keep them from getting wet. Now, what's wrong with this approach? What's the real problem? They're just treating symptoms. The water on the floor. Would it not be wiser to attack the roots of the problem? To attack the causes of the problem? You see, what we need here is not a team of doctors and nurses who are specializing in mopping up. No, what we need here is a plumber to come in to take care of the leaking pipes. But you know, since mopping up pays well, we don't stop and go upstream to prevent the cause. And it has a powerful effect on our national budgets for health. Please take a look. We're now spending 86% of our national medical budget in America on managing the symptoms of chronic disease. We're spending 86% on mopping up. We're no longer curing. We're merely managing chronic disease symptoms because these chronic diseases are largely related to our habits. Our habits are the real cause. And habits cannot be cured by some mechanical device or by some medication. And look at the escalation of what we pay for this approach. In 1960, we spent 5% of our income as a society on medical care. This year, it will be 20% of our income. And yet, with all this money being spent, our life expectancy is declining and our chronic diseases are on the rise because our culture is promoting a lifestyle that is aversive to health. We say, eat, drink, and be merry, and the doctors will take care of you tomorrow, right? Are you sure? But can you really reverse these chronic diseases? Do you have a cure for them? Well, let me take you to Norway. 1940. Nazi armies invaded Norway. They occupied the country. They took all the livestock to feed their soldiers. And what happened to the health of the Norwegian people? They had to grow their own vegetables in their gardens. And with that, in spite of war, fear, anxiety, and stress, wouldn't you have expected an increase in heart disease? Not so. As is shown here in World War II, the death rates from heart disease in Norway and in many other occupied countries in Europe markedly diminished and declined. Well, could it be that a very simple diet counteracts the effects of stress on the heart? Please take a look. When the war was over in 1945, guess what happened? People went back to their pre-war diet and the death rates of heart disease went up again. Isn't that amazing? So we know from the experiences in World War II, we know that these chronic diseases like heart disease and diabetes and hypertension could be brought into a declining state. We also know from experiments with monkeys that we can create heart disease in monkeys by feeding them a diet high in cholesterol and saturated fat. But what about reversing these narrowed arteries? Here's Dr. William Castelli, the former director of the famous Framingham Heart Study. He said, if you want to reverse coronary artery disease in these monkeys, all you have to do is feed them a simple, low-fat, natural, whole food diet. What is he saying? Foods as grown, plant-based whole foods. And then people say, well, yeah, okay, but that's monkeys, right? What about humans? Any studies there? Oh, yes, there are. Here's Dr. Dean Ornish, a prominent cardiologist who for more than 30 years has raised many eyebrows in breakthrough therapies using a lifestyle medicine-oriented approach. In 1990, he published his findings in the British medical journal Lancet, which turned the medical world upside down. He took 48 heart disease patients and randomly assigned them to intensive care, where he gave them a very simple diet, very, very low in fat. He exercised them. He offered them stress management and no smoking. That's for half the group. The other group followed the advice of their physicians. These heart disease patients received the usual care. Avoid smoking, do some exercise, follow the diet of the American Heart Association, which would allow you 30% fat diet and cholesterol-containing foods. And then after 1 year, Dr. Ornish did the PET scans. These are sophisticated x-rays of the arteries, and he found, number one, in the green box you see 82% of the plaques, that's the buildup on the inside of the coronary arteries, had regressed and begun to melt down. He also found, number two, that the plaques of those patients who were in the red box following their doctor's advice had actually gotten worse. Here, 53% of those people had a progression in their plaque buildup. He also found, number three, the intensive care group lowered their cholesterol by 24% without medication, just with diet. In contrast, the usual care group of patients following the American Heart Association diet only brought their cholesterol down by 5%, which is not sufficient to reverse the atherosclerotic buildup in the arteries. Here's a summary of Dr. Dean Ornish's work with heart disease patients. It says, he has scientifically proven that people can open their blocked arteries without drugs or surgery. He guides them through a rigorous lifestyle program where the key issue is a very simple diet based and focused on whole foods, plant-based. So that's Dr. Ornish's work. And then you have Dr. Caldwell Esselstyn from the Cleveland Clinic. He started his experiment around the same time that Dr. Ornish began his. Single-handedly, this physician used a whole food, plant-based diet, very low in fat and oil, in helping people with heart disease to reverse the disease. Many coronary patients, described as the walking dead, became members of his research study. They already had their bypass surgeries, they already were on the best medications, and they were told at the Cleveland Clinic, look, we've done everything we can for you, that's all we can do for you. And so 24 desperate patients with heart disease enrolled in Dr. Esselstyn's study. 18 of these patients continued with him. These 18 coronary patients had been treated at the Department of Cardiology at the Cleveland Clinic during the previous 8 years. During that time, their cholesterol had averaged about 238 points, and even though being treated by some of the best and finest cardiologists in the country, notwithstanding this, these patients during the 8 years of treatment experienced 49 cardiovascular events. And then, almost as a last-ditch effort, they came to Dr. Esselstyn and they said, look, we don't know what to do. We have had all the surgeries, we had all the medications, there's nothing your surgical colleagues and doctors can do for us anymore. Can you help us with your dietary program? So he put them into his lifestyle medicine program. Following his simple diet of more traditional foods as grown, cholesterol levels dropped very rapidly to a new average of 145 points. Remember, it used to be 238. And in those next 5 years, because they were now older, they should have had more heart disease, more clinical events, more cardiovascular events. But they experienced none whatsoever. Over the following next 7 years, the cholesterol was still being kept below 150, which apparently provided these patients with a coronary safety. But look at the data. Over those total of 12 years, again, 0 cardiovascular disease events. No strokes, no heart attacks, no stents, no surgeries. But think about the contrast. 8 years of the treatment by some of the best cardiologists with the best medical care, and yet 49 cardiovascular events. And then these patients, now 12 years older, who should have had at least 49, if not more cardiovascular events, had none whatsoever. The heart disease had been arrested. The heart disease was now in the regression and reversal mode. So to summarize, 18 patients stayed on his program for 12 years. No cardiovascular events. But 6 patients dropped out during those 12 years. What do you think happened to them? These dropout patients actually had 13 cardiovascular events, in contrast to the patients that followed through with the program who had none. You see, the way we live is the way we die. And here you see some of the documentation. These are special angiograms. They're special x-rays of the arteries. You see the coronary artery there? You see the circle on the left side? This important artery severely narrowed by atherosclerotic buildup with little blood flow through the coronary artery on the left. On the right side, this is now 32 months later. The same artery, the same patient, the same circle, but this time the angiogram on the right shows a fully opening artery with optimal blood flow. And obviously, the patient had no more angina pain. With a very low-fat, whole food diet, you see the blood viscosity decreases within weeks. The blood becomes thinner, and as a result, the blood can now pass with greater ease through these narrowed arteries, which in time will begin to open up anatomically as well. Here then is Dr. Esselstyn's statement. He said, "Stents and bypasses have their place in emergency settings. However, their elective application can neither prolong life nor protect from a heart attack. In contrast," he said, "plant-based nutrition, which treats disease causation, can arrest and reverse cardiovascular illness and stop the epidemic."
All right, so can you cure heart disease just with food? The question might seem strange, but our Dr. Sanjay Gupta has living proof of it. It is part of his fantastic special report called The Last Heart Attack, which you can see this weekend on CNN. Sanjay joins us live from Atlanta now. Sanjay, you spent the last year looking into heart attack and heart disease for your special. You have a history of it in your family, and you've really studied how people can get away from that and get out from under that. What if you don't want to use medicine, statins, to reduce your risk of heart attack? Can you really use food as medicine?
Well, you know, it's interesting, Ali. Hippocrates has talked about this for more than 1,000 years, and I walked into this with an open mind, but the answer is definitely yes, you can. And we did find living proof of this. Sharon Kintz is a woman that we profiled, 66 years old, had a heart attack, was told by her doctor she needed to have heart surgery, and she said no. And she basically adopted this plant-based diet. As you can see there, she's been very strict about it. You know, whole grains, lots of vegetables. Been doing it for over a year, and it's quite remarkable. Not only in how much she has not had any symptoms of heart problems, but also in terms of her energy levels. And this is something that I, really focused on with her. She could barely walk before all of this. And literally now, a year later on this plant-based diet, she's able to jump rope. I mean, take a look at that, Ali. She couldn't do that before, and I'm not saying that obviously being on a plant-based diet taught her how to jump rope, but people always question, do you have enough energy still on one of these diets?
Right.
And we profiled her just to demonstrate.
All right, so it's a pretty serious diet. It's a pretty extreme way to go. Is there science that proves it's working other than the fact that she can jump rope and she's fit?
Well, yes, there's a couple of different things. First of all, people really oftentimes want objective signs to show that there's changes in someone's blood vessels. And we talked about this before, Ali, not just in terms of showing a slowing of heart disease, but an actual reversing of heart disease. In order to prove that, a patient would have to undergo another angiogram. Sharon's doing so well, she said she had no need to undergo an angiogram. But let me show you a patient who did do that. And this is over a period of a few years. Take a look over here, and I don't know if you can appreciate this, where the arrow is. This is a coronary blood vessel, and this is what one of those narrowings looks like. This is what a heart attack waiting to happen looks like. This is someone who decided not to undergo surgery, which was recommended, instead using food as medicine. And take a look now over here, same spot, and that coronary blood vessel is essentially, it's opened up. It's about the same normal caliber as the rest of the blood vessel. That is sort of what we're talking about here, Ali, in terms of providing some sort of objective evidence. Remarkably, despite the fact that, again, Hippocrates has talked about this for over 1,000 years, this is still a relatively nascent science. I think more studies are going to be done can see more images like that.
And we've talked a couple times this week. We'll talk again about the different ways. I mean, you're not advocating just one way to prevent a heart attack, but the special is called The Last Heart Attack. So do these patients that have been profiled who have followed these diets to reduce their clogging of their arteries, have they prevented heart attacks?
Well, let me tell you, yes. And let me tell you the study that basically pivoted me into saying we should do this as a full hour. It's still a relatively small study because this is some emerging science, but Dr. Caldwell Esselstyn, basically he followed patients for 12 years, and what he found was that 6 patients out of a group of about 18 dropped out of the study, and out of those 6 patients, they all had some sort of coronary event. 2 patients died, 4 patients needed bypass surgery. Of the patients who stayed through, kept the diet, kept it going for 12 years, so most patients were able to do that. Only 1 patient died, and in an autopsy, that patient did not have any evidence of heart disease. So again, Allie,
Wow.
The evidence is pretty compelling, not only in terms of slowing down the progression, but really reversing it. These patients needed to have heart surgery, and then they essentially needed no interventions whatsoever
That is
over a
incredible.
12-year period.
That is incredible that you can undo that damage possibly. All right, Sanjay, thanks again for joining us.
And now, let's go to the halls of power in Washington. Let's take a look.
How did you lose so much weight? What kind of diet are you on?
Well, the short answer is I went on essentially a plant-based diet. I live on beans, legumes, vegetables, fruit, no dairy, and it changed my whole metabolism, and I lost 24 pounds, and I got back to basically what I weighed in high school. But I did it for a different reason. I mean, I wanted to lose a little weight, but I never dreamed this would happen. I did it because after I had this stent put in, I realized that even though it happens quite often that after you have bypasses, you lose the veins because they're thinner and weaker than arteries. The truth is that it clogged up, which means that the cholesterol was still causing buildup in my vein that was part of my bypass. And thank God I could take the stents. I don't want it to happen again. So I did all this research, and I saw that 82% of the people since 1986 who have gone on a plant-based, no dairy, no meat of any kind, no chicken, turkey, if you can do it, 82% of the people who've done that have begun to heal themselves. Their arterial blockage cleans up. The calcium deposit around their heart breaks up. This movement has been led by a doctor named Caldwell Esselstyn at the Cleveland Clinic, Dean Ornish in Minoa in California, the doctors Campbell, father and son, who wrote the China study, and a handful of others. But we now have 25 years of evidence. And so I thought, well, since I need to lose a little weight for Chelsea's wedding, I'll become part of this experiment. I'll see if I can be one of those that can have a self-clearing mechanism. We'll see.
I hope you're healthy for many years and get to see grandchildren for many years
Me
to
too.
come.
That's really the big deal. You know, Hillary and I, we're happy. We love our son-in-law and we admire him, and we'd like to be around. If there's grandkids, we want to be there to do our part.
Mr. President, good luck.
Thank you.
Thanks for what you're doing.
Thanks.
And take a good look at this new man, a president who has adopted a new lifestyle where food becomes the new medicine for him. It's the new entertainment style of Bill Clinton, since he saw the film Forks Over Knives, which actually means that when it comes to heart disease, the fork may be more important than the knife of the surgeon. Well, we can talk about diabetes too. We can disarm, we can arrest diabetes. This is really not that difficult to do once you make those dietary changes. Look at this 1955 study. It's one of many studies I could have cited here. Here, Dr. Inder Singh took 80 diabetic patients on insulin. He gave them a very low-fat diet of natural whole foods, and within 6 weeks, 50 out of 80 diabetics on insulin had their blood sugars normalized and were free of any insulin. They were no longer on medication. They were no longer diabetics as long as they followed the program. And then here you see Professor James Anderson, a personal friend of mine actually. He has written over 500 books, articles, and chapters in many, many books. He spoke here in Loma Linda in 1980, and he said even then, some 50 to 75% of type 2 diabetics on insulin and 80 to 90% of those on pills could normalize their blood sugars and be off medication within weeks if they changed their diets. And the same thing is true for high blood pressure. Here's a 3-week residential program where people are following a very simple dietary program plus exercise. And look at the results. 55% of these high blood pressure patients on medications, at least 2 years, were no longer on medication within 3 weeks. And their blood pressure levels were now totally normal. Well, this is pretty exciting when you are seeing those results. People that were dependent on these medications and suddenly they're free. They don't worry about side effects anymore. They don't have to worry about, did I take my medication this morning? Did I take it last night? They're free people again. Well, we're moving towards the end of our program. Let me show you my very last video clip. Let's take a look.
My name's Joe Monaco, and prior to the CHIP program, my life was basically starting to spiral down with one kidney. Lost my kidney 20 years ago. I've had diabetes for over 10 years. I really owe this CHIP program for turning my life around.
Around the world, there is a pandemic issue. Lifestyle diseases are taking over.
When we look at the disease burden in the United States and more around the world, what we see is that it's chronic disease. It's these non-communicable diseases that stay with people for weeks, months, years, even decades.
Being a medical doctor, knowing a lot about medication and drugs, I'm not against conventional medicine. I really feel it has its role, but we know that when it comes to lifestyle, conventional medicine doesn't do very well because we treat the results, we're not actually managing the cause. And this is where CHIP is so incredibly powerful.
My husband joined the group, which surprised me because he's been a butcher all his life. He actually lost 10 kilos in the first 4 weeks.
What a joy to see someone respond in a way that our medication can't fix.
CHIP can be the connection for people that don't believe that they can do better to become whole person health warriors. And I think that's what CHIP is all about.
These are things that I want for my patients, and to be able to do that with this natural, holistic approach rather than prescribing a pill, to me, it's the best thing in the world.
The transformation of lives that I witness, this is priceless. There's nothing that could buy that.
I think we've realized when we look at health and wellness that there's the mental aspect and the spiritual aspect. And if you don't address those issues, often people don't really get as well or improve as much as they should. And that's been the joy of running a CHIP program that is so balanced the way CHIP is presented.
My world is better.
What a joy to see lives turning around. And here are some of my recommendations for your consideration. First of all, we need a new cow that's high in fiber and no cholesterol, all natural. Then we need to look at the dietary pattern recommended by Harvard University. Fill half of your plate with lots of vegetables and fruits, then fill a quarter of your plate with whole grains, and then finish it up with plenty of healthy protein foods such as beans and lentils, but also, if you need to, some lean animal products if you insist. That's what Harvard recommends to prevent and reverse these diseases. But note, no milk at the Harvard program. It's only water instead. And here is the Physicians Committee for Responsible Medicine, Dr. Neil Barnard's recommended dietary pattern for preventing and reversing common chronic diseases. And again, a full plate with lots of fruits and vegetables and plenty of legumes and whole grains. And here is what it looks like in actual numbers when you contrast the American diet and the optimal diet as used in the CHIP program. Look at the fats and oils. We really need to cut back from 100 grams on the average down to about 40 grams. And look at the cholesterol. We need to cut back from 300 milligrams to less than 50 milligrams. Of course, as a total vegetarian, you wouldn't have to worry about cholesterol, it's zero. By providing up to 50 milligrams, however, we're opening the doors just a little bit for some animal products if people insist that they must have them. Look at sugar intake. Cut back from 35 teaspoons down to less than 10 teaspoons a day. And salt? What about salt? The body requires less than 1 gram of salt a day, but we're taking in 10 times that amount. So try to cut your salt amount at least in half. And when it comes to fiber, most people don't get more than 10 grams a day. By shifting towards a whole food, plant-based dietary program, however, we will automatically get 35 to 45 grams of fiber a day as recommended. With that, you would alleviate a lot of problems of the intestinal system and would also strengthen the immune system. So when it comes to water, well, of course, most of us don't drink enough, so we should really push that quite a bit. And this means then a more optimal diet would help us to eat more whole foods, foods that we can eat as much as we want, as they're grown without all the fats and oils and sugars and salt. It's also optimal in the sense that we would try to keep refined processed foods at a minimum. And if you really want to eat animal products, we recommend use them only as a seasoning or as a condiment. This then is the kind of diet that we recommend. Take a look. Fresh fruits, vegetables, whole grains, legumes, good whole bread, and lots of water to drink. Couple that with exercise, with stress management, and obviously no tobacco, and you have a prescription for a longer and happier and healthier life. Now, in case you think I cannot really make this big jump all at once, I understand. Here on the left side, you have the red triangle with a typical American diet: meat, dairy, eggs, cheese, processed foods, alcohol, and caffeine. And of course, you also have the worst health outcomes as you see on top of that box. These are the Western diseases, the chronic diseases that have now gone global. But then, as you move towards the right side, you begin to eat less and less of these foods in the red triangle, and you begin to eat more and more foods in the green triangle, where you emphasize fruits and vegetables, whole grains, lots of beans and legumes, and some nuts and seeds, and plenty of water. And this is also where you find the best health outcomes. Eating plant-based is also about widening our circle of compassion and avoiding unnecessary pain, suffering, and death. As we become more mindful of our friends and animals, our feathered friends offer us some well-intended suggestion. Take a look. Eat more kale. And then, to finish it up, here's Dr. Dean Ornish. What's good for you and your health is also good for our planet, and it's good for the animals. And they will thank you for it too. Although heart disease and diabetes kill more people each year worldwide than all other diseases combined, these diseases are completely preventable and even reversible for at least 90% of the people today if they change their diet and lifestyle. So, we have a choice. Moving towards a plant-based, whole food diet seems to me to be a very responsible and enlightened choice on a planet that is fighting for its survival. Fork and knife? Either these are weapons of mass destruction or they can become instruments of hope, health, and healing. What are you putting at the end of your fork? Blessings. Blessings on you and good health.